Dear students, Assalamu alaikum. In the last lecture, we studied various fluid compartments and the methods to measure fluid volumes. In this lecture, we will learn about basic principles of osmosis, calculation of osmotic pressure, and osmotic equilibrium. We continue with the determination of volumes of some other body fluid compartments. Calculation of intracellular volume. The intracellular volume cannot be measured directly. It is calculated as total body water minus extracellular volume. Measurement of plasma volume. To measure plasma volume, a substance must be used that does not readily penetrate capillary membranes but remains in the vascular system. Most commonly used substances are radioactive iodine labeled serum albumin and Evans blue dye. Calculation of interstitial fluid volume. Like intracellular volume, the interstitial fluid volume cannot be measured directly. It is calculated as extracellular volume minus the plasma volume. Blood volume can be calculated using the following formula. Total blood volume is equal to plasma volume divided by 1 minus hematocrit. Radioactive chromium is also used to label the blood cells. These are injected and mixed in the circulation. The radioactivity of the blood sample is measured and total blood volume is calculated using the indicator dilution principle. This table shows a summary of measurement of fluid volumes in the different fluid compartments. Now we study basic principles of osmosis. The reason is that it is important while treating seriously ill patients to maintain adequate fluids in the body compartments, and the distribution of fluid between intracellular and extracellular compartments is determined by the osmotic effects of solutes like sodium and chloride. Now, to know this fluid distribution, we need to understand the basic principles of osmosis. Let's start with the osmoles. The total number of particles in a solution is measured in osmoles. One osmole is equal to 1 mole of solute particles. However, 1 osmole is quite a big quantity, so in practice, the term milliosmole, which equals 1 divided by 1000 osmole, is commonly used. A solution containing 1 mole of glucose in each liter has a concentration of 1 osmole per liter. If a molecule dissociates into 2 ions giving 2 particles, then a solution containing 1 mole per liter will have an osmolar concentration of 2 osmoles per liter. Similarly, a solution that contains 1 mole of a molecule that dissociates into 3 ions, such as sodium sulfate, will contain 3 osmoles per liter. Osmolality and osmolarity. The osmolar concentration of a solution is called osmolality when the concentration is expressed as osmoles per kilogram of water, and it is called osmolarity when it is expressed as osmoles per liter of solution. The total osmolarity of each of the 3 compartments is about 300 milliosmoles per liter, and the corrected osmolarity is about 280 milliosmoles per liter. This is because cations and anions exert interionic attraction, which causes a slight decrease in the osmotic activity of the dissolved substance, thus giving the corrected osmolarity. Calculation of osmotic pressure of a solution. This is the picture of Mr. Vant Hoff, who formulated a law to calculate the osmotic pressure of a solution. According to Van Hoff's law, particles in dilute solutions obey the ideal gas laws. The osmotic pressure pi of a dilute solution can be given by the following equation. Pi is equal to mRT, where m is the molarity of the solution, R is the gas constant 0.064, and T is the absolute temperature equal to 300 Kelvin. To understand Van Hoff's law, let's calculate the osmotic pressure of 0.9% sodium chloride solution, also known as normal saline solution. Now 0.9% solution is equal to 0.9 grams per 100 ml is equal to 9 grams per liter. Gram molecular weight of sodium chloride is equal to 58.5 grams. And molarity of 58.5 grams per liter sodium chloride solution is equal to 1. So, molarity of 9 grams per liter sodium chloride solution will be equal to 9 divided by 58.5 is equal to 0.154 m. Therefore, osmolarity of 9 grams per liter sodium chloride solution is equal to 0.154 multiplied by 2, because there are 2 ions, is equal to 0.308 osmoles per liter, or equal to 308 milliosmoles per liter. Now, as we have now calculated the molarity of the sodium chloride solution, we can apply the values in the formula. Pi is equal to mRT, 308 multiplied by 0.064 into 300. This gives us the value of 5,944 millimeters of mercury. So that is the osmotic pressure which is exerted by the normal saline solution or 0.9% sodium chloride solution. Let's study about osmotic equilibrium. and how it is maintained between intracellular and extracellular fluid. While calculating the osmotic pressure of 0.9% sodium chloride solution, we have seen that large osmotic pressures can develop across cell membranes. So keep in mind, for 1 milliosmol concentration gradient of an impermeant solute, about 19.3 millimeters mercury osmotic pressure is exerted across the cell membrane. Therefore, if the cell membrane is exposed to pure water and the osmolarity of intracellular fluid is 282 milliosmoles per liter, that is the corrected osmolarity, the potential osmotic pressure that can develop across the cell membrane is more than 5400 millimeter mercury. Now, this is a very huge value and shows the large force that can move water across the cell membrane when the intracellular and extracellular fluids are not in osmotic equilibrium. Therefore, as a result of these huge forces, even small changes in the concentration of impermeant solute in the extracellular fluid can cause large changes in cell volume. Now let me explain the effects of different concentrations of solutes in the extracellular fluid on cell volume in the next few slides. If a cell is placed in a solution of impermeant solutes having an osmolarity of 282 milliosmoles per liter, the cells will not shrink or swell. So such a solution is said to be isotonic because it neither shrinks nor swells the cells. Examples of isotonic solutions include 0.9% solution of sodium chloride, commonly known as normal saline solution, and 5% glucose solution. Now, if these solutions are administered to a patient intravenously, there is not going to be any changes in the fluid compartments of the body. If a cell is placed into a hypotonic solution that has a lower concentration of impermeant solutes, that is less than 282 milliosmoles per liter, water will diffuse into the cell, causing it to swell. Solutions of sodium chloride with a concentration of less than 0.9% are hypotonic and can cause cells to swell. If a cell is placed in a hypertonic solution having a higher concentration of impermeant solutes, water will flow out of the cell, causing the cell to shrink. And examples of hypertonic solutions are the sodium chloride solutions with a concentration of greater than 0.9%. This figure summarizes the effects of isotonic, hypertonic, and hypotonic solutions on cell volume. You can see in the panel A that if the extracellular fluid is isotonic, there is not going to be any change in the volume of the cell. And if a cell is placed as shown in panel B in a hypertonic solution, the cell is going to shrink. And in the panel C, you can see if a cell is placed in a hypotonic solution, the cell will swell. Eventually, it can burst. Osmolarity and volumes in abnormal states. Now, extracellular and intracellular osmolarities and volumes can change significantly in several clinical conditions. It is therefore important to study what changes can occur in extracellular fluid and intracellular fluid compartments if fluids are added or removed from them. To understand this, let's study the effect of adding saline solution, that is a 0.9% sodium chloride solution, to the extracellular fluid. This figure shows the normal status of body fluids. Intracellular fluid is shown by the pink box. Extracellular fluid is shown by the yellow box. Volume of intracellular fluid is equal to 28 liters and the volume of extracellular fluid is equal to 14 liters. While osmolarity is around 300 milliosmoles per liter. Effects of addition of isotonic solution will include the osmolarity of the extracellular fluid does not change. The only effect is an increase in extracellular fluid volume. In the figure shown opposite, the normal state is indicated by the colored boxes and the shifts from normal are shown by the interrupted lines. So there is only an increase in the extracellular fluid volume. Effects of addition of hypertonic solution will include an increase in the extracellular volume, a decrease in intracellular volume and a rise in osmolarity in both compartments. And lastly, we'll see what are the effects of addition of hypotonic solution. The effects are the osmolarity of extracellular fluid decreases. Now both intracellular and extracellular compartments have the same osmolarity, but both intracellular and extracellular volumes are increased. Just go through these last slides and try to understand these concepts. With this, I end today's lecture.